This is the reason why your chronic cough that's been bugging you for over 3 months, maybe 2 years, maybe post-COVID just won't go away. So you went to the primary care doctor and a bunch of specialists begging for some help, and you thought that the medications would resolve it. And maybe some of your cough is gone, but you changed nothing about your lifestyle and behavior. So here's why that frustrating cough and throat clearing tickle didn't get much better. Because you didn't work with a chronic cough coach. That's right, a chronic cough coach is a specialized licensed speech language pathologist who can guide you in improving your life. The biggest mistake a lot of coughers make is that they look to medical intervention only. Because long lingering cough and throat clearing usually is multifactorial, well, it needs more than just medical intervention. So that you're not stuck in the social stigma of coughing in public because people think that you're sick, but you're not. There's something called neurogenic laryngeal hypersensitivity. So here's the takeaway. Chronic cough is a common complaint in the general population, and globally it affects approximately 10% of the adult population. And here's how you take control of your cough. Research proves that behavioral cough suppression therapy is up to 88% effective at treating neurogenic laryngeal hypersensitivity. So as the healthy, vibrant person that you are, it's time to get out in public without worrying if you'll evacuate an elevator due to your cough attack. I have 3 life-changing tips that will help you eliminate or reduce your cough sensation. So if you want to take back control over your life, then send a direct message with trigger word cough right now. I've got this all laid out for you in detail. Can't wait to help you soon.